Good morning, everyone. Jim Laird joining you live from New Orleans, Louisiana. And we got Miss Lauren with us today, making the show look way, way better.
Good morning, Jim.
Good morning to you. Thank you for making the show look better.
Oh, stop. Did I just hear you're in New Orleans?
I'm in New Orleans. That's right.
Wow. You're making
Yeah.
your way.
I'm making my way. I was in Pensacola yesterday, New Orleans today, hanging out with one of our clients.
Great.
Going to help him with some things. And then we're making our way probably to Corpus Christi. And then make sure I have everything in line to go into Mexico. So
Excellent.
we're getting there slowly but surely. Who knows where I'll be next? So good times. So make sure you get on our email list. On Thursday, Dr. Stillman and I are doing one of our weekly lessons for our Fundamentals of Wellness Mastermind group. This one is on how to manage being driven, which is a pretty hot topic. And most of the people we deal with in the practice on the coaching side and the medical side are really driven people. And they have to learn how to manage that, to get a different health outcome from the choices they've been making. So go to stillmanwellness.com and you can get on the list, and we'll send you that out Wednesday night so that you can get on that live. And if you can't make it, the good thing is if you register for it, you'll get a replay for that. So you'll be able to catch up. So virtual medicine, this is really, since the beer bug has really become a big thing, right?
Yeah.
And how long have you been working virtually?
Since probably the start of COVID,
Okay.
where I was previously, which was a hospital. I worked in an outpatient center,
Okay.
and like overnight we went virtual. So everybody had to sort of learn very quickly how to manage virtually, and everyone adapted really well, patients, providers, from my perspective.
Sure.
And that's one benefit that came out of COVID is, we were pushed to do things that we didn't really see in our future so soon.
Yeah.
And, it allows us here in the practice to take care of patients all over. Patients are able to do it in the comfort of their own home. It sort of takes out the white coat syndrome too, that some patients may have, and the beauty of wearables. We can track patients' progress, their vital signs. So it's, it could be very seamless.
Yeah. Well, I think there's some benefit to meeting in person, and we obviously have that available to meet people in person, particularly for people that are not in Florida or Virginia and New York?
Right.
Is it, or just Florida and New York, essentially?
Florida, New York.
Yeah. For people that aren't in those states, you can come visit us in person. We have very limited availability on that. I think there is some benefit to that, but also on the other side, Dr. Stillman and I have talked about this at length. If you open a in-person practice, your overhead goes through the roof.
Yeah.
And so you've got all these extra bills. So when you're going to your regular doctor, you're not only paying for him, you're paying for all the bills. And there's bills on the virtual side too, right? Obviously, you've got to maintain websites and all that stuff, but it's a fraction of the price of having a building, right?
Right.
And so that allows us to provide more care. And that's really, and Dr. Stillman really, when we started working together, and he really started to see the value of actually coaching and interacting with people on a regular basis, because that's what moves the needle. Most people need new habits. They need accountability. Most people, it's death by a million paper cuts, right? Sometimes there's like a few big rocks that they're really screwing up. But most people, it's like the little things that are really cumulative over time that get them into the health outcome that they're in, right? So it enables us to see more people at a reasonable price, but also interact with them more in group coaching calls. We have group calls on the medical side. We have group calls on the coaching side for people that need a little more accountability. We have the app now with daily accountability apps so that people we can check on them every day to make sure they're doing what they need to do. Right. So that's really the thing I see as a huge advantage. Plus it allows me to develop, or when you only see a doctor every couple months and he tells you to do a few things, and then you see him 4 months later and you haven't done any of those things, or you've had a relapse.
Yep.
all that time has gone by, right? But if you're
Absolutely.
getting to know somebody too, and you're talking to them on a regular basis, you start to get to know them. You start to get to know that maybe there's things in their life that are causing issues, and not just like they're missing this nutrient or that. There might be some psychological stress or some all sorts of different things that they need, additional, neurofeedback, or they need maybe some counseling, or they need whatever. You get to know these people, and that's where the real magic happens, when you get to know
Right.
people and kind of, do they have an exercise addiction? Do they have an eating disorder? These are things you can't really pick up on if you have like one or two conversations with somebody. This is things that you can get little clues over time.
Yep. And having the, accessibility to us and the practice, I think it really makes people feel more comfortable, and,
Yeah,
like there is a chance to reach your goals, and it makes it more attainable because you have that interaction. Um, so there really are many valuable pieces to the virtual model. Um,
absolutely.
if there's
And
something that we feel we can examine, and, we will make the recommendation if we can't see that patient in person, that, maybe it's best to have somebody put their hands on you and examine
right.
you. And we can make that recommendation based on, what they're telling us and sort of what's going on. But I think overall, the biggest thing, like you said, Jim, is being able to follow them closely and see their daily habits and get to know them, get to know their family.
Hmm.
There's so many times you're on the call with patients and you get to see their whole family, and it really gives you a great look into their life. Um, and you can identify different things that you need to help them with.
Right. And it's so hard to find a good doctor. Like the gentleman I'm seeing right now has a great in-person, doctor. And he was like, should I stop using her? I'm like, no, 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 absolutely
Yeah,
not. You need to
right,
have, I think having multiple opinions, multiple perspectives, multiple people to go to, um, is valuable. So that's another thing that virtual practice allows you to do, or having virtual physicians available, is to get different opinions from different people at an affordable price, right?
right.
Because a lot of times for the in-person stuff, the waiting lists are just absolutely insane. You
Yeah,
might not be able to get to see somebody for a while, especially if they're good, right?
right.
So you might not be able to get in right away. Whereas, on the virtual side of things, there's a little more flexibility, particularly if you're licensed in those states. So that's really valuable as well. I've always tried, if I've had anything major, I've tried to get multiple opinions. Because a lot of times it's things get overlooked, so to speak.
Yeah. Yeah, there's definitely a benefit to having different people with a different set of eyes and a different skill set even.
Well,
Um,
and different experience too.
right,
A lot of this is like a lot of the great mentors that I've had. You're absorbing their experience and their questioning and their interview process.
right.
That's a very valuable thing that is developed over years of trial and error, right?
Yeah,
I think another advantage is on our end, right? So we can work from our home, so to speak, or from your patio.
yeah,
We can also be anywhere in the world. We can move, and that's one of the reasons I really I honestly prefer working with people in person. But I'm willing to accept the fact that I want to work virtually, so I can live in places like Nicaragua. I can move around. I can travel. I can do those things. For somebody like me who likes to kind of be a traveling gypsy, it works out. It works out really well.
oh yeah, we can't deny the benefits for, the practitioner side and our side, that we do get to do it from the comfort of our home. We can move, we can plan our schedule accordingly, and the patients can relate to that too, you
Hmm.
know. And if
Yeah.
something comes up, you can shoot them a message easily, and it really allows you to build such a great relationship with patients.
So you're speaking of moves. You're in the middle of a move right now, right?
I'm in the middle of a very big move, and my dog does not understand what's happening as we speak.
My dog always gets he can tell when something's happening. He gets that kind
Yeah.
of look in his eyes. He's like, "What's going on, Dad?"
Yes.
And so he's been doing a lot of that lately, but he loves sleeping in the car. So luckily that's good. But he's here at the place I'm at in New Orleans. They have a corgi, and then they have like a little mini Eskimo dog. It kind of
Oh,
looks like a husky, but it's not a husky. I don't know what it is, but So I don't think the corgi's run around that much in his entire life. The poor thing, the short little legs.
They're
And
so cute.
Rommel, I wore him out this morning for an hour and a half playing catch in the front yard. And so he's got two little buddies, which he's not used to having.
That's
so
great.
It's pretty interesting. They're very dog friendly. I was going to have him sleep in the truck, but they were like, no, bring him in. So it's got to watch out for the Christmas ornaments. So
Yeah.
he doesn't snag Christmas ornaments and start destroying them, so that's, I don't want to be replacing Christmas ornaments. So
no, you don't need that. Well,
I don't think it would look kind of weird if I was going into the store buying Christmas ornaments by myself.
He's going to be a well-traveled pup. Just let his head hang out the window and his ears flop. He'll have a great
time.
day.
He's doing great. So, well, good luck with your move.
Thanks,
so
Jim.
And you have yourself a wonderful day. If you are interested in becoming a patient of the practice, you can go to stillmanmd.com and fill out the patient application form. And I have no idea what my topic's going to be tomorrow. I'll figure it out. If you have a suggestion, put it in the chat. I've got a few things spinning around in my head. I got some really good interviews coming up here with some different people. You want to be here on Friday for Coach Summer, gymnastics bodies, former U.S. Olympic gymnastics coach. That's going to be fantastic. He's him and I are going to have a good banter, and it'll be fun. He's a incredible coach, so it'll be fun to chat with him as always. So have yourself a great day, everyone. Make sure you get outside. You deserve it.
Bye-bye.
Bye, Miss Lauren.